Me to have the opportunity to moderate this panel. We are welcoming two legislators here that have recently been recognized by our Virginia Chamber of Commerce Board. Senator Dunnavant was actually honored May 15th and received the Legislator of the Year award for the Virginia Senate. So we congratulate her again and thank her for her business leadership. And Delegate Morefield was represented for receiving the Free Enterprise Award for improving Virginia business climate. So we can give him a round of applause and thank him for his business leadership. And Dr. Melton just keeps getting promoted. If you followed his career, we are excited to have the administration represented as well. I'm going to ask them each to just take 1 minute, tell you what part of the Commonwealth they represent as a member of the General Assembly, or what agency and responsibilities you oversee. So, Senator, I'll start with you.
Good morning. I'm Siobhan, and I am the senator for the 12th senatorial district, which is Western Henrico and Western Hanover, and I happen to be an OBGYN as well. So this is very near and dear to my heart.
My name is Hughes Melton. I serve as the, can you hear me? My name is Hughes Melton. I serve as the Commissioner for the Department of Behavioral Health, there we go, and Developmental Services, and that agency is responsible for the behavioral health, the addiction treatment, and then also taking care of our disabled, developmentally disabled and intellectually disabled population in the state. I hail from Southwest Virginia, where I was served as a Chief Medical Officer in a health system down there and trained in family medicine and addiction medicine.
My name is Will Morefield. I represent the 3rd District in the Virginia House of Delegates. I was elected in 2009. It's an honor to be here with all of you today to discuss this extremely important issue that has ravaged all of Southwest Virginia and the entire Commonwealth for that matter. So I'm looking forward to the discussion.
Well, thank you all for the introductions. I want to start with Dr. Melton. We hear a lot of numbers about how this addiction problem impacts Virginia, and I'm just curious if you could share with us top line, what are some of the observations you have about the impact on Virginia, its productivity, and potentially even the business community?
Sure, Barry, thanks. And it's important when we talk about addiction that you understand that it's a chronic relapsing disease of the brain, not that different from depression, because the costs, because of that, and because it manifests behaviorally, the costs really go all across the entire community. So they are intellectual, they're emotional, they're relational, and they're also financial. In 2017, we lost a little over 1,500 Virginians to overdose, a little over 1,200 specifically due to opioids. And that is not the news that we want to hear. It was a 7.5% increase from the year prior, which was significantly better than the year prior, where we had a 35% increase. And so in a sense, the rate of the increase of the epidemic has slowed. We're hopeful that it will peak and start to come down. You can't predict that, but we're hopeful. And I use a numbers analogy, so to speak, to try and understand really what's happening. So it's 1, 10, 50, 150. So for every one person that dies from an overdose, there are 10 individuals in treatment. There are 50 who've been seen in the ER, and there are 150 who have the disease. And so when you see that overdose statistic, it's just the tip of the iceberg of the number of individuals who are struggling with the disease of addiction who are working in your workplace. Specifically around finance, and I want to thank Kim McKay with the Chamber. About 3 months ago, I guess, Chicago was doing some groundbreaking work in trying to estimate the impact of addiction on different sectors of the business economy. And so she actually reached out to them and worked with them to get some Virginia-specific numbers. So financial impact to the business community can be broken into sort of 3 areas: lost time, job turnover and retraining, and then the cost of healthcare. Injuries, increasing insurance rates for you. And in Virginia, it's about $550 million for the first 2 groups and about $350 million for the 3rd group. So a total annual cost to the Commonwealth of about $1.4 billion. The GDP for the state's about $435 billion, I think. And so you can get a sense of the impact that it's having. And that in particular, the state grows at about 0.75% annual compounded growth rate. And that 1.4 billion represents about 0.35%. So if we didn't have that drag on the economy, that cost of the economy, then perhaps the state could be growing at a 30 or 40% faster rate.
Big impact, no question about it. And the large employers and small employers here feel that when they're trying to retain their workers as well as bring on new workers.
Right.
Senator Dunnavant, you have a unique perspective as a medical professional, as a senator, a public policy maker. You carried a bill this session to establish the Substance Abuse Data Sharing and Analytics Clearinghouse. Can you talk about that legislation a little bit, and what do you hope to accomplish?
Yes, it will surprise you to know that the state really doesn't have access to its data very effectively. We have an enormous amount of data. It's in silos in different agencies, but it can't readily be used by any of us to kind of look at circumstances. And in many cases, it's very difficult for the agency itself to look at the data and to pull that data. Other states have overcome this obstacle by finding ways to legally make the data private so that they're not compromising any federal law, privacy law, state code, any of that, but Virginia hasn't accomplished that yet. And this is, I think, particularly acute in the opiate crises. We spent a lot of time looking, I think of it kind of as a bimodal situation that we can work on as a legislature. We can try and reduce the number of people who are getting addicted, and about 70% of addictions start with a prescription from a healthcare provider. So we worked really hard over the last several years to change the framework by which we prescribe, and prescribe at much lower amounts, and to track that and to monitor that very closely, kind of maxed that out. On the treatment side, we've got access to things like ARTS, which I assume Dr. Melton will talk about in a few minutes, where we have really, really good treatment, but sometimes we can't connect the dots in between. And within these silos in criminal justice, for instance, you have things like all of the robust programs that are being offered in the jails. You have drug courts, which really, make no mistake, are a treatment modality for addiction. And you've got even Narcan that's administered in the field. Over in the healthcare silo, you have evidence of people who are in treatment in different places, in different localities, and also maybe through Medicaid. None of that information can talk to each other. So the goal of kind of building a data infrastructure for Virginia, where we'll be able to have access to this data and use it more wisely in making decisions, will start with overlapping the criminal justice silo with the healthcare silo. And that way, if somebody gets Narcan in the field and they're maybe in a treatment center in another locality, and localities are important here because they can't talk to each other either. So the way that we are all kind of have blurred lines now, if somebody's in treatment in Hanover, but they go into a hospital in Henrico and they were seen maybe by the police department in Chesterfield, nobody knows the continuity for that individual. And it's very hard to solve this problem if we can't build a system of continuity to treat this relapsing, challenging disease. So I think that's kind of where we are on data, and it's a very collaborative, bipartisan process. The governor has switched his Secretary of Technology to a Chief Data Officer.
Yeah.
So we will be looking at this full force.
Well, thank you for your leadership on that, and we look forward to the implementation. Delegate Morefield has a unique perspective. I'll let him share. He's a small business owner. He's from rural Virginia. I'd like for you to share your public policy view, but also the impact on small business and the impact on your family.
No, thank you. Without question, this epidemic has affected every single family in the region that I'm from. And personally, I've been affected. Our family has been affected. We lost my brother in 2011 from an opioid overdose. In 2015, I lost my father from an opioid overdose. I have a sister, younger sister, who is recovering from addiction right now. And this is a common theme that we hear throughout Southwest Virginia. The situation has continued to get much worse than we ever anticipated. From a public policy perspective, I think it's integral and very important that we as state legislators are involved in addressing this epidemic. If we look at the access to naloxone, for example, there have been literally hundreds of cases since that legislation has gone into law that has saved many lives. In fact, just a few days ago, I was reading an article on Tuesday. A baby was suffering from an overdose, an 11-month-old baby that the father was prescribed Suboxone. And because of the legislation that was supported overwhelmingly in both houses and passed into law, that baby's life was saved. And those first responders were able to administer the naloxone, and the baby regained consciousness. And so, you know, these are big policies where we can have a tremendous impact on their lives. If you look at the opioid crisis, and I've said this on many occasions, what's happening in Southwest Virginia and in some of the poorer areas of the Commonwealth is quite possibly a picture of 20 or 30 years into the future of what other areas could potentially look like. If you look at the correlations, whether you're in Southwest Virginia or Southside Virginia or even the Eastern Shore, there's a direct correlation with poverty and drug use. But I think we all understand that just because you're living in a poor environment doesn't mean that you're subject to addiction. We see this in all levels of socioeconomic classes. And so I think that from a business perspective, one of the challenges that we have been faced with is this has become part of our culture, unfortunately. And this is a reality that our business owners are faced with every day. And I think that one of the leading issues that we need to start addressing is criminal justice reform. Every day we receive phone calls, or even if I'm in the grocery store, people who are unable to attain employment because of a felony conviction. And in many cases, these are people who are first-time offenders who have been charged with a felony, and simply because of a company's policy, they're unable to be employed. And these are good people that we're all human, we all make mistakes, and because of this, they're not able to be employed. So I think that we're seeing a lot of changes within the General Assembly. We're electing younger members to the General Assembly. I think that for far too long we have had policymakers that felt like that incarceration is the key to solving addiction, and you all in the healthcare industry understand that that's not the solution. If someone's diagnosed with cancer, incarcerating them is not going to cure them. So how can you say that incarcerating a drug addict is going to cure them? So as Senator Dunnavant mentioned, more focus on our drug court programs and criminal justice reform is something that we could do as policymakers to make a substantial impact. So.
Thank you for sharing. It's also a partnership with the federal government, and we want to make sure we call on the federal government to help us. Dr. Melton, you recently had the benefit of announcing a $9.7 million grant that Virginia received. Can you tell us a little bit how that might help us fight the opioid addiction?
Sure, you bet, Barry. Thanks. So the $9.7 million that Virginia got was our portion, our state's portion of the $500 million that the federal government made available through the 21st Century Cures Act. And that money came with sort of how it was supposed to be used, of course, like the federal government will do. And it was to be used to focus on prevention, treatment, and then recovery and harm reduction, which is the typical structure that you use to approach a population health issue. And so the agency took that money, and in discussion with the General Assembly, they said, well, treatment needs to be a focus of the use of that money. So $5 million of it needs to be used for treatment. We're like, you're right, because we're in the middle of an epidemic, and treatment saves lives. And so we put the bulk of it towards treatment. On the prevention side, we focus on trying to address the issue of stigma and educate individuals about the disease of addiction, because you can't effectively respond to it as a family member or as a community leader or as a business leader if you don't really understand the nature of the disease. So we touched about 6.5 million Virginians through that targeted media campaign. We also touched about 2.3 million individuals around safe disposal, because as Senator Dunnavant said, nowadays, addiction starts about 70% of the time through exposure to prescription drugs. 30 years ago, it was flipped, 70% through exposure to heroin and other illicit drugs. And so the third thing was supporting the prescription monitoring program, which this state has one of the best prescription monitoring programs in the state, and seeing a 50% almost decrease in the number of pills prescribed of opiates. And so success there. On the treatment side, mainly that was using the funds to get individuals without insurance into the programs that Senator Dunnavant mentioned that are being stood up by Medicaid in the ARTS program, evidence-based treatment. And so we had a goal of getting 500 individuals with no insurance coverage into treatment. Halfway through the year, that's the most recent data we have, we've gotten 285. So we're ahead of schedule in that regard. And then on the recovery side is where we are just now seeing success. So we wanted to focus on how do you intervene when somebody comes into the ER with an overdose to get them into treatment. And there are specific strategies out there that some states are a little ahead of us, so we're catching up. In particular, Rhode Island has an excellent model, and as does Maryland. And so we started working with some of our local health systems to say, can we put peer recovery specialists in your ER? In order to do a warm handoff between that individual who has come in with an overdose but now has been reversed by the Narcan that Delegate Morefield mentioned, and get them set up immediately into a program. And so just 6 weeks ago, we identified our 5 ERs across the state. That's what our target was for the first year grant. We also identified 5 ERs that would work with us to pilot a program like that. So we're on track. We do have another year of funding for 2018, and we're hopeful, and that's where Secretary Kerry is actually with a congressional delegation today, speaking with Senator Kaine and some of our other federal congressional members to say we need ongoing funding.
Yeah.
Thank you.
It's definitely going to be a partnership between our federal representatives and our state. Thank you for explaining that. Let's talk a little bit about curbing this epidemic. You're going to hear different ideas today. Senator Dunnavant, as a doctor, what do you think? And as a policymaker, what do you think can be done to begin to curb this epidemic in the Commonwealth of Virginia?
I think that's the answer we'd all love to have. And I'm hoping that data will help us sort that out. I'm hoping that education will help us sort that out. And there's a lot of bright points that are working towards that. One thing that is a little unconventional that we had talked about before, Barry, to speak on was the fact that Virginia has just made it possible to get access to compounded cannabis. And in the states that have any form of medical cannabis, there is a 25% reduction in the death from overdose rate. And biochemically, we still have a lot to learn about cannabis, but make no mistake, there is data to support using it for a lot of different disease processes, and that's one of the changes we made this year. 2 years ago in Virginia, we said we're going to go ahead and compound medical form cannabis, either in CBD oil or THCA oil, but it's only going to be for intractable epilepsy. This year in the legislature, we were able to get it through basically with unanimous support for any condition that a physician decided was meaningful. And so there's a lot of inflammatory diseases, but for cannabis specifically, for opioids specifically, it keeps the body from responding to opiates in the typical way, which is to create more opiate receptors. And this is why people develop some dependency and need for more and more and higher doses to curb their pain. It also has an anti-inflammatory effect. So the bottom line is, individuals with chronic pain are able to get better relief from smaller amounts of opiates and are therefore far less likely to have overdose from it. So I think that's one unconventional thing that we had wanted to talk about today.
The Chamber in our blueprint talks about prosperity for the Commonwealth of Virginia. We recognize that not all regions in Virginia will grow at the same rate, but our goal is that all regions in Virginia will be growing. And Delegate, when I think about Southwest Virginia, and I served 4 years as Secretary of Commerce, and that region has always been in transition, it seems. For the last 20 years, it's been in transition. And I wonder how you view economic development opportunity and how this opioid epidemic is impacting the opportunity to grow the economy.
Well, unfortunately, it didn't take me very long to realize after I was elected that the more sense something makes, the more complicated government can make it. And we have, just like other regions of the Commonwealth, over the years have become dependent on one or two industries, and as a result, our economy has been affected. And particularly in our area, the coal industry. Our region became heavily dependent on the coal industry, and over the years, we have declined in production of coal, which has resulted in people leaving the region. In fact, several of the localities, one of them that I represent, Buchanan County, lost nearly half of its population in the past 30 years. And when we look specifically at how do we address this opioid crisis and the other issues as well, my personal opinion is economic prosperity is the solution. It's the long-term solution. Earlier I mentioned that what we're experiencing in our region has now become part of the culture there, and we have to figure out as policymakers, how do we help private industry break this vicious cycle. And often, me being a Republican, we often hear conservatives make the comment that government needs to stay out of the way. I believe that to a certain extent, but we're in a situation now of complete desperation, and I believe it's our responsibility as policymakers, and there is a responsibility for government intervention, whether it be in healthcare or in the business sector. A leading example would be the legislation that we partnered with Delegate LaCherice Aird on. When we first started our discussions on the legislation, I started researching the demographics and the statistics of the area that she represents, and they were very similar. Yeah. The population decline, the poverty rates in Buchanan County are 28%. The poverty rate in the city of Petersburg is 28%. Yeah. So very, very similar. And we wanted to come to the General Assembly session with a new approach, something that's never been done before, to do one thing, to attract jobs, to attract investment into our region because of the mass exodus that we've seen. So I think that with the passage of Medicaid expansion, that is something that I did not support in the past, but I did support this past General Assembly session because I felt like we have an obligation to address those issues because our federal representatives don't seem to be fixing the problem. And I'll give you an example of the common sense comment. So in the past, Medicaid, a childless adult was not eligible for Medicaid. Now a childless adult will be eligible for Medicaid. And when you look at some of these areas, these economically depressed areas, you find situations where families are having 4 and 5 and 6 children. And the more children they have, the more benefits they receive. So that goes back to what I was saying, is that no common sense. So I think with these reforms that we're making, we're trying to show the people that we're applying common sense, and we're making every effort that we can to create innovative ways to attract investment into those areas that we haven't seen in 40 or 50 years. So.
This issue of economic prosperity can bring Republicans and Democrats together. We recognized both the delegates for their work in that innovative economic initiative this year. Commissioner, we've spoken to the governor and the secretary. They're in Washington this morning. They'll be flying back after lunch today for kind of a historic day within the Commonwealth of Virginia. For those of you who don't know, the budget passed and there's Medicaid expansion in the budget. And it's... And the purpose of our panel is not to debate that issue, but simply to recognize that there was some bipartisan work done in the Commonwealth of Virginia. And I thought I would ask you, Dr. Melton, if you want to take a minute and talk about the administration's priorities in healthcare, and then I know the governor and I've talked about this specifically around the opioid addiction.
Sure, thank you. So yes, thank you to the General Assembly and to the business community, in particular the healthcare side. Lots of support in order to be able to get to where we got last Wednesday and the bill signing today. And so now it's time to execute, is what I tell my team. It's going to take a lot of work, and it's going to take a collaborative approach to an issue like this. Expanding Medicaid isn't just the job of DMAS. It's going to be multiple agencies working together in partnership with their stakeholders in the communities in order to get it rolled out, in order to create the waiver that's going to redefine some of the benefits. And you're right, that's a whole other conversation. So that certainly was one of Governor Northam's major objectives. So the other four healthcare major objectives or major priorities for the governor and his administration are an area of mental health, addiction, maternal child health, and women's health. And really all four of those are touched by the addiction epidemic. And so specifically in the mental health and addiction space, it's the organized administration's approach started back in the McAuliffe administration with the governor's task force, where they came up with 50 recommendations, and I think we had accomplished 30 of those by the end of the McAuliffe's administration. And so now that's evolved into a group that involves multiple secretariats, in particular public safety, health and human resources, and the Department of Education. Coming together, and they have key priorities. Some of the ones just to mention today would be, we look at that again, prevention, treatment, harm reduction. That's the way we're organizing our approach. And in the area of demand prevention, so when you talk about prevention, you want to prevent the demand for the substance, you also want to prevent the supply of the substance. So on the demand prevention side, we see certainly we have a role at the state level, but so much of the work that's done, and in particular identifying what needs to be done in a particular community, is led by local community coalitions. And so we're working to try and make sure that every community has a vibrant, functional, effective coalition of stakeholders that are identifying what are the needs in that region and seeking to find the resources to meet those needs. The second area would be in the area of treatment and recovery. And in that area, we're really looking at workforce. And so, there are different ways to look at workforce. One is, of course, from the way you look at it, is available workforce for you to employ, right? And so if we can get our arms around the addiction epidemic and get individuals into treatment, into recovery, then they come back into the workforce. And at a time, I think we were talking last night, our unemployment rate is 3.6, 3.7 in Virginia. Nationally, it's 4.1. I mean, workforce is a major challenge for you in the business community, finding individuals who can work. We also look at workforce from the perspective of who's going to provide the treatment. And so seeking to work with our schools in order to get more individuals into that workforce, into the behavioral health services and mental health services in order to be able to provide the treatment that's needed by our citizens across the state. The third area would be harm reduction. And harm reduction takes a couple different forms. One would be the availability of naloxone, like we talked about, so preventing the harm to the baby who has been exposed to buprenorphine, as Delegate Morefield talked about. But it's also, how do we prevent the spread of hepatitis C and HIV through engaging individuals who have the disease of addiction and are using drugs IV. And that most effective outreach for that is through syringe service programs with comprehensive harm reduction. So somebody comes in, they're an IV drug user, they are educated, they're offered treatment, and they're also offered needles that aren't contaminated. And so we are seeking to establish those programs in communities in the Commonwealth that want them and need them based off their demographics in their community. And we're seeing some success there in Southwest Virginia in particular, and we think you'll hear this coming year of a number of others that have opened. And the fourth area would be in the area of public safety. And we talked about our jail population, our justice-involved population, getting treatment to the individuals in our jails so that when they transition out, then they don't relapse, because incarceration is not treatment. But more and more we're starting to see partnerships between community service boards and other private providers and the jail systems to get treatment to the individuals, so when they finish their time, they go back into the community, they get a warm handoff.
Thanks for sharing that. Let's think about the business community of the Commonwealth. Certainly there's a role for us to play. And I'm curious from your perspective, either in business or your perspective as a public policy maker, I'd like for you to speak, Senator, just for a minute, as you think about the responsibility, the role, the opportunity for the business community in the Commonwealth. What do you think the role the business community can play in supporting efforts underway to help in this opioid crisis?
Well, couple of comments. I think one of the most important things that we'll need to do from this point forward is not to topple over each other. There's a lot going on. There's a lot bubbling up organically in communities. There's a lot that's going to be coming from the state. And we'll have to be very careful about how we do structure things to make sure we meet the need. I hope that this is going to result in a very, maybe even radical change in how we provide services in Virginia. So from the get-go in this General Assembly, we've been talking about making sure people with any eligibility criteria that this touched on, substance use disorder, mental health disease, chronic life-threatening illness, had coverage from the state. The question is, how do we make sure that patient has continuity of care? And this is something that's very familiar to us in the healthcare arena, but it's not how we practice in the state of Virginia. So if you get into jail with a substance use disorder, which I agree, it's a disease, not a crime. There might be crimes associated, but we need to, we're not going to get any better by keeping them in jail. We're going to get them better by getting them treatment. That patient is discharged from jail after treatment with 2 days of medication, and then they're on their own. And they're not necessarily connected to the services that are in the community. This is just not how we take care of people. This is not how we do it. They then end up in crises and end up in one of our 9 mental health hospitals that are at 98% capacity. And so we really need to restructure how we care for individuals now that that's how we're going to do it. And we're going to kind of abolish the silos is what I'm hoping for. As far as the business community is concerned, I think there's a lot to be done. I would like to raise the question, and here we're talking about opiates, obviously, but we're also talking about workforce. There are some federal guidelines by which we're not testing for marijuana anymore when you're talking about testing individuals for workplace competency or being able to function. And we have manufacturers and other people that come to us all the time that say patients can't pass the drug test. As we all know, marijuana stays in your system for an extended period of time, and it may or may not reflect whether or not you are competent to work that day. I think the workforce is going to have to take a hard look at, obviously you don't want somebody on opiates using heavy machinery, but we need to take a look at what keeps us and keeps people out of the workforce, and are those relevant parameters for us to be using? And I think that's something really important we need you to ask and answer, and I think you're going to find some federal guidelines that maybe question how we're doing it in Virginia. So that's one important thing. Education's really, really, really important, and we have to allow reentry. The number, when you look at treating this disease, it's not 6 months of treatment. It's not a year of treatment. It's often 2 years of support and treatment with ongoing support forever. It's more like diabetes than anything else. You can't really cure diabetes, but you have to sustain it and take care of it. You wouldn't take insulin away from that individual. You've got to give the supports to these individuals they need to continue to succeed. But a really important part of that the drug courts have that we don't necessarily have at Medicaid or the state level is, does that individual have employment? When you look at successful reentry and recidivism, somebody who is clean for a period of time, that has the support mechanisms, that follows up with the support groups, and has a viable income, those are our successes in this opiate crisis. So we need you to help us employ them, and we need you to help us find ways to get them re-entered into the workforce in a meaningful way where they have a sustainable job and not just something that maybe would benefit them better to be back selling drugs if that was one of the incentives they had for being involved before. So I think those are probably my thoughts here.
Good ideas. Want to continue on the theme of the role of the business community. We have in the audience some of the largest industrial employers in Virginia, human resource officers from medium and small size employers. let's continue to talk about the role the business community plays, because I think we have a responsibility, and those are excellent suggestions. Delegate, when you think about the business community's role, whether it's in Southwest or across the Commonwealth of Virginia, what do you think the business community's role can be in this initiative?
I would say getting more involved with your policymakers in these types of discussions is crucial. Often there's a divide between our elected officials and our private sector, and you would think that wouldn't be the case, but in many cases that is the case. And so I think that a leading example would be Medicaid expansion. For example, there was an assumption statewide that many in the private sector were opposed to Medicaid expansion, but after calling many of our employers in Southwest Virginia who are conservative, what I would call conservatives, I was quite surprised we're in favor of Medicaid expansion. And they were in favor of it because they felt like it was an opportunity to improve the quality of life and the health care for the people of our area. I think getting involved and especially across the Commonwealth in stressing the fact that drug courts are effective, that going back on the issue of incarceration, that's not the solution to solving drug addiction. In fact, over the past couple of years, we have hosted meetings with former Secretary Hazel, our representatives from our Commonwealth Attorney's Office in localities that we represent, and industry leaders with other members of the House of Delegates and Senate to convey the message that drug courts are effective. They are working in Southwest Virginia, therefore they can work throughout the entire Commonwealth. So I would encourage you as members of the private sector to get more involved in those types of discussions with your policymakers, because they will listen to you, or at least we hope they do.
Well, thank you. We just have a couple of more minutes left, but I wanted to ask you, Dr. Melton, if you would speak for the administration on its interest in working with the business community and what role the business community can play to help the administration implement some of its vision and goals for the next 3.5 years.
Yeah, absolutely. I mean, I just come back to the statistic that 80% of the treatment is provided by the private healthcare industry. It's provided by business, provided by many of you and the folks that you work with in our communities. And so we will not get there without a close partnership with our business community. Two specific areas. One, the whole getting a clear understanding of the nature of the disease to try and address the issue of a stigma. I think businesses can play a role in that. And I was talking with Carol Pratt earlier in our partnership with VHHA and a number of other agencies where we'll come to your local chamber and we'll provide a seminar over breakfast. We've done one in Smith, one in Bristol. We have one coming up in Amelia and one coming up in Roanoke, I believe. There's no date set for that one yet. But we would love to come to your location, bring together your local chamber, and have a conversation about the nature of the disease. Specifically, how does it look in your community? Because it really does look very different in different parts of the state. And then the last thought I'll leave with you is when you make decisions on the type of insurance to either put before your employees or to actually provide, different businesses have different solutions, some self-insure, to be thoughtful about what are the benefits that are being offered through that insurance product in the area specifically of behavioral health, mental health services, and addiction services. Because you're the buyer, and the insurance industry is sensitive to meeting your needs. And so if you insist upon coverage that provides treatment parity to your employees, then they will get as good a quality treatment for their mental health and addiction issues as they also get for their diabetes or their depression or some of the other medical issues. And so you can significantly impact the nature of care that's available to your employees based off of the discussions you have around that area of your human resources work in your business.
60 seconds left. Just want to ask the senator and delegate if they have anything else they'd like to add, either from the public policy realm that you hope to see maybe in the future as legislators, or any other ideas you have for our audience today. Senator?
I'll just say thanks for having us. This is a really important topic, and having you included in the conversation makes a difference. For me, the hallmark conversation to always have with the Commerce is please get involved with the Chamber of Commerce is to please get involved in education. For some reason, there's a mysterious disconnect between some of the higher ed in Virginia and businesses, and we don't always prepare. This is a little bit separate from the opiate crisis, but I'm hoping we're going to see over the next 5 years or so a complete dovetailing between our new high school redesign and entry into the workforce, entry from the community colleges and from the 4 years. But we need to have your input, because some of the programs that we're providing students are laborious and long and drawn out and not very successful in getting them employment. And I think you can define what that looks like for us, and we need your help. Thank you. Delegate?
Thank you, Barry, and thank you to the Virginia Chamber for giving us this opportunity to come and speak with you all today. As I said earlier, I'm encouraged with the changes that we have seen in the General Assembly and the direction that we're moving in. I think that more focus on alternative medicines is something that Virginia should seriously be looking at. This is a real epidemic that we are experiencing, and if you haven't been to Southwest Virginia, I would welcome you there, and we would be more than happy to take you around to the various agencies that are dealing with this, and businesses that are dealing with this on a daily basis, to give you a real perspective of what could possibly happen in other areas of the Commonwealth in 20 or 30 years. And so I think we have a real opportunity to prevent what is happening in our area, to prevent this from happening in other areas, but then also an opportunity for you all to get more engaged and involved with policymakers who are making these types of decisions to help address those very problems that we're experiencing in our regions. And so I can't thank you enough for giving us this opportunity.
You're welcome. Ladies and gentlemen, thank this panel for their public service. Thank you all very much.